Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto, Willies. Welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Listen, folks. He is an American advocate for health insurance payment reform. He is a former health insurance industry executive, a communications director. He is the New York Times bestselling author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. He's a critic of HMOs and the tactics used by health insurers. Wendell Potter is one of our leading national advocates for major reforms of the insurance industry, including a supporter of Medicare for all and universal health care. He is that voice that we need to be listening to right now, especially in these times. Welcome to Politics Done Right, Senor Potter. Well, you said Wendell. Welcome to Politics Done Right. How are you doing today?
Thank you, and please do call me Wendell. It's good to be on the show. Thank you so much.
Well, look, let me tell you, it has gone from bad to worse. I remember during the Affordable Care Act, you had said, watch what's going to happen if we don't get the public option in the Medicare expansion. They will game it again. I just want to start there before we get into the core of what we're going to talk about. Your thoughts?
That's right. I testified before Congress a number of times when members of Congress were debating what became the Affordable Care Act. And I said that if they pass that bill without a very good public option, that they might as well call their bill the Health Insurance Industry Profit Protection and Enhancement Act. The House did pass a version of the bill that had a public option. The Senate did not. And so we wound up without it. And I hate to say I told you so, but since that time, big insurance companies have gotten so much bigger, so much more profitable. They're massively bigger than they were when I was in the industry and at that time, to the point that two of those big insurance companies are now number 5 and number 6 on the Fortune 500 of the biggest American companies. Their profits are outsized, and they are just able to do pretty much what they want to do. They're controlling our healthcare system in ways that I feared, and we've simply got to do something about it. We really need to wake up to what's going on.
Now, you were an insider. You were a part of this whole entire insurance industrial complex, if you will. What within your soul made you say, you know what? I'm going to leave these millions of dollars that my future worth would be, and I'm going to do what's morally right. What got into you that? Because I want to, for the audience, I want to say something that's important, Wendell. The current people in the healthcare industry, in the insurance industry, they are doing their fiduciary responsibility, which is to maximize the profits for their shareholders, enhancing the executive bonuses. They're doing nothing illegal. They're doing what they're supposed to do. You are just a cog in the system.
That's
what
right.
Wendell has said is that's not how a healthcare system should be run. It shouldn't be run in that framework. Run with that, sir.
Well, that's right. When I first started working in healthcare, I was working for a nonprofit hospital system in Tennessee, where I'm from. Then I went from there to work for Humana and then Cigna. So 20 years I spent inside two of the biggest insurance companies in the country. And I, at first, was unaware of the implications of for-profit companies or Wall Street controlling our healthcare system. But I became more and more aware of the consequences as I rose up through the ranks at those companies. I was able to see things that most people do not have a chance to see. I worked very closely with the CEO and the CFO, the investor relations team. I came to just see and understand how Wall Street does control our healthcare system or controls those companies. and any other company that is an investor based or owned by investors. I had a crisis of conscience. In my first career, I was a newspaper reporter, and I tried to make sure that I was telling the truth and never obscuring anything that was important for people to know. But I came to realize that's exactly what I was doing in my role. I was vice president of corporate communications for Cigna. I worked, one of my name was on every one of the company's earnings releases for 10 years. So I had to know how these companies made money, where it came from, and what they did with it. And I came to realize that the way they made their profits was, in many cases, making sure that people did not get the care that they needed. And the system that we had in place was one in which increasingly Americans were not able to buy insurance. 50 million people didn't have insurance when I left the industry and when Congress began debating what became the Affordable Care Act. I came from humble beginnings. I grew up in rural East Tennessee in a working class family, farming family. And I know what poverty is like. I know what it is like when people do not have access to care. Some things happened to me a few months before I decided to leave my job that just made it abundantly clear to me that I was doing the wrong thing, that I was contributing to the problems in our healthcare system. And I decided I couldn't do that anymore.
You tell a story about seeing people come down from the hills to get healthcare, to get free healthcare, and the impact it had on you, your psyche. Tell me a little bit about that.
Yeah, while I was still in my job, I flew back to visit family in East Tennessee, and I read in the hometown newspaper about something that I'd never heard of before. An organization called Remote Area Medical was hosting a big outdoor clinic at a county fairground not too far from where I grew up. I was curious because the article said people would be coming from hundreds of miles away, even as far away as Ohio and Florida, to get care that was being provided free by doctors and nurses and dentists who were volunteering their time over 3 days. This was in late July, and I went there again out of curiosity, and I saw something that just shook me to my core when I went into the fairground. People were lined up by the hundreds, waiting patiently to get care. It was raining that day, so these people were soaking wet, but they were not going to be leaving their lines because they had been, in many cases, sleeping in their cars for days to get an opportunity to go inside the fairground to get the care that they needed. And I saw that some of those lines led to barns and animal stalls on that fairground site. This was a county fairground. And I just immediately realized that I had to take some responsibility for what I was seeing, because my job was to help perpetuate the system that we had in place, the system that still is in place. And I made a commitment that day that I would have to find some other way to earn a living. I saw people there who could have been people I grew up with, could have been my neighbors, could have been high school friends, could have been relatives of mine. And tears flowed down my face as I was looking at what I was seeing. And I made a commitment to try to figure out what I could do about that. I didn't think I would be a whistleblower, but I just knew that I couldn't keep doing what I was doing, despite the fact that I was making quite a bit of money.
It's interesting because you're a whistleblower, and you've blown the whistle and you blow the whistle over and over again. And it's amazing how the gravity of the system is so self-sustaining. One of the things that I promise to do in my life and with my platform, and hopefully with your help and the help of everybody else, is to just let the average rank and file American understand what you saw there is not an anomaly, but it's something that's out there throughout this country, the richest country in the world, where we can't get the healthcare that not that we deserve, but the healthcare that as a rich country, we have all earned. We have all earned, irrespective of whether you are a McDonald's flipper or an executive in a corporation. Now, it turns out that in the past, one of the reasons Medicare came into be is because private insurance couldn't quite find a way to profit from the healthcare on older people. So
Right.
therefore, as usual, the things that are not that the private sector cannot make a dollar on, they usually pass it on to the government. The government will take care of that. So Medicare was passed on to the government. Now, following that, bribing politicians, these guys figured out a way we can take back Medicare in a more secure, in a more advantageous way for us. Why don't you explain to us that procedure that occurred that has led us now to Medicare Advantage, a big one of the largest frauds on the American taxpayers?
You're exactly right. Insurance companies had no interest in trying to insure older people, people on fixed incomes, people who didn't have a lot of money. Those people couldn't afford their premiums. So that you're right. That's why the Medicare program was created. But over the past several years now, past 20 years in particular, these companies have figured out, because of their closeness to politicians, they were able to convince politicians that let us take care of access to care for people who are enrolled in Medicare. We can do it more efficiently. We can make sure that people get the care that they need and cost taxpayers less money. That certainly was, they sold policymakers a bill of goods. I, at the time, thought, well, maybe that is something that can be pulled off. So I was going along with it. But what we have seen is that more and more taxpayer dollars are going straight into these big companies. And what they're doing through their Medicare Advantage plans. Medicare Advantage, by the way, was created in 2003 by when Congress passed what was referred to or called the Medicare Modernization Act. It created not only the version of private Medicare that we have now, but also the Part D prescription drug plan. And both of those programs have turned out to be extraordinarily big cash cows for big insurance companies. And they have been aggressively marketing these plans to the point that more than half of people who are eligible for Medicare in America these days are enrolled in one of these plans. And they're extraordinarily profitable because these companies have been able to rig the system to get more and more money out of the federal government, out of our tax dollars. And one other way that they're able to make so much money is by refusing to pay for care that people need. There's a practice called prior authorization that is used aggressively by these companies to make sure that people are not getting the care that their doctors know they need. So people are dying. People are dying prematurely because of these denials and delays of care in Medicare Advantage.
Now, let me ask the question this way. How do you convince a politician that a government who is administering Medicare, whose sole expense is administering that bill, figuring out how to pay, figuring out if there's fraud here or there, compared to a private company that has to pay high-paid executives, that have to pay bonuses, that has to pay shareholder dividends, that has duplicative services, meaning if there are several insurance companies, each of them have their own database administrators, advertising budgets, all that sort of stuff. All of those are all costs coming out of that same pot that the government would have to spend out of if it didn't. In other words, all those costs are costs not going towards healthcare. It's going towards administering.
Yeah.
Why would they fall for the private sector fallacy that's been told many a times, that in every case, the private sector is more efficient than the public sector?
Really three ways. One is obscuring that kind of information, to hide that, to not talk about that. You don't ever lead with that kind of information. The other is through relationships and ideology. You are able to convince politicians that you have helped fund their campaigns, that are ideologically aligned with your point of view, who have the opinion that the private sector can do anything better than the government more efficiently. And a lot of politicians, a lot of people buy into that. We in this country have this notion that the capitalistic system is sacred. and something that can always do a better job of whatever it might be than the federal government. So you have that. But the other thing is what I was alluding to, campaign contributions and lobbying. These companies are able to shell out millions and millions of dollars every election to campaigns, and they send money to both Republicans and Democrats, and that's protection money. And they spend a lot of money on lobbyists. Every big company has a lobbyist on staff, but also spend enormous sums of money hiring firms that do lobbying in Washington and the state capitals. So you have all of those things playing together, and that has got us to where we are now. It's lying and obscuring information. It is lobbying, and it is campaign contributions, and just frankly, ideology. So many people are blind to the fact that these companies are ripping off taxpayers left and right.
Before I came on with you, the first Saturday of every month, I have a program, an addendum to my radio show called Ask Egberto Anything. And I told them today that I was speaking to you, and, they were very happy to know, wow, you're speaking to Wendell. Ask him 2 specific questions. Since we're talking about Medicare Advantage, they said, what can we do to change the name Medicare Advantage to something more appropriate to let people know Medicare Advantage is neither an advantage nor is it Medicare?
One thing is to support a bill that was introduced by 2 members of Congress, Congressman Mark Pocan of Wisconsin and Ro Khanna of California. They are the lead sponsors of a bill that would prohibit these companies from even using the name Medicare in their marketing materials. That is really important because people don't know the difference. And the advertising that they do conflates the 2 programs. People don't know that Medicare Advantage is really a privately operated big business. They don't really understand that, and the advertising purposely obscures that. So that's one thing. One is to support that legislation, to write letters, make phone calls to your members of Congress to support that. And also to support legislation that would crack down on how they're marketing these plans. There are also bills before Congress that would do that. I'm seeing that members of Congress are beginning to wake up, certainly on the Democratic side, but even Republicans are beginning to understand how the program that they largely created has been ripping off taxpayers, has been depleting the Medicare Trust Fund. But it requires people to reach out to their members of Congress and say, this is something that has to change. And the various ways we have to change it is, number one, like you were saying, keep these companies from even using the name Medicare in their marketing materials.
The next question, and this I think is a difficult question. I don't even know where to start, but right now we spend more than twice what probably the most expensive country spends right now on their healthcare. How can we, forgetting about insurance and all of that, how can we reduce the amount that's being spent on healthcare, given that our outcomes are no better than the other countries?
Well, you really do have to have a fundamental rehaul of our healthcare system to do that. The biggest reason is because of administrative costs in this country. About a third of what we spend, and we now spend $4.5 trillion on healthcare altogether, which is, you're exactly right, is twice as much as the average of all the other developed countries in the world. And those other countries provide better care than we do, and they provide universal coverage, and we don't. And it's largely because, number one, the administrative cost, when you have all these insurance companies and for-profit entities involved in healthcare, every one of those adds to administrative costs. When you have these private insurance companies operating, all of those companies have high administrative overhead, but they make it necessary for doctors and hospitals to also have administrators, people who do nothing more than work day in and day out with big insurance companies. So that's a big thing. And the other is to just curtail the power of these big companies, break them up. You've got, like I said, United Healthcare is the 4th largest company in America. CVS, which owns Aetna, is the 6th largest. Cigna, where I used to work, is the 15th largest. They're far, far bigger than they were when the Affordable Care Act was passed. We've got to work with our members of Congress and the administration with the FTC to call for these companies to be broken up, because we're getting to the point that you've got just a very, very few large corporations run by Wall Street and investors that is really calling the shots. And they don't have any incentive in bringing down the cost of care, because as the cost of hospital care goes up, as the cost of drugs go up, these big insurance companies just increase premiums. And that is costing our employers and all of us as employees and taxpayers enormous sums of money that's simply unknown in other countries.
Um, as someone who understands that Medicare for all, healthcare for all, universal healthcare, whatever you want to call it, one word, we are all have healthcare. It's a right that we all have healthcare. I understand that if there's a single payer handling that, I understand that if we take the for-profit method out of the delivery of the service, out of the administrative service, that it would be more efficient. My question to you, given the infrastructure that we have in this unwieldy system, what would be the pathway? What would be the migration from this unwieldy system into a well-organized healthcare for all system?
It's a very good question. And I think there are various ways of getting there. One is to try to get it done in Washington. That's a very, very heavy lift, as we've seen. There are organizations that have been trying to get that to happen for more than 30 years. The other is through the states, and some states are considering legislation, California in particular, but also other states have legislation that will be considered that would create a state-based single-payer system, or some kind of a system that would be similar to other countries around the world, other developed countries that are doing this much better than we are. So that's one way. I think it is going to be very, very hard for us to see that kind of change in Washington until we do something about who is in Congress. You've got the makeup of Congress now such that it's not going to happen in the foreseeable future. So we've got to get involved in the political process. My second book was called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that is at the core of the problem that we have, is that these companies are being able to control the levers of power in Washington and the state capitals. We've really got to address that. And whenever I have a chance to talk to people who support single-payer healthcare, Medicare for all, whatever you want to call it, or just to progressively improve the system that we have, you're running up against the power of these big corporations that spend so much money, as we were talking earlier. So you've got to do something. I ask advocates, try to devote some time and attention to money in politics, because that is so important, so fundamental, and it's a big barrier to getting to where we need to be.
Wendell, my last question is always the same. What would you have liked me to ask you, or what should I have asked you that I didn't?
I don't know that you've covered fundamentally, I think, the biggest questions, the biggest reasons why we are where we are and what we need to do. I think that I would say that to get to universal coverage, let's not get hung up necessarily on one path. We've got to consider how else can we get there? What other things can happen? And I would say that employers have a big responsibility as well, too, because so many of us get our coverage through the workplace. I would encourage people to talk to their employers, to their HR people, to protest the fact that every year our premiums go up, our out-of-pockets go up. So we've got to wake up and realize that our pockets are being picked day in and day out. I lead a coalition of organizations called Lower Out-of-Pockets Now. There's stuff that has to be done that's incremental before we get to single-payer healthcare, so that we're not spending so much money and not being able to pick up our medications, not being able to go to the doctor because of the high out-of-pocket costs that we are subjected to. So there's a lot that we can do as advocates other than just supporting Medicare for all or universal healthcare, whatever you want to call it. We've got problems right now. People are dying every single day because of the practices of these companies. So I would encourage people to pay attention to that and call on their lawmakers to do something about the things that can be fixed right away, rather than looking down the road to achieving a healthcare system that is more just. There's some steps we can take right now to get us closer to where we need to be.
I'm glad you said that because that also helps me because there are certain times that I just want to jump on it and get it done all right away. But you're absolutely right. There are things that we can do incrementally right now that eventually puts us on the path there. Wendell, you have a newsletter that is packed with information. And I tell you what, I am ashamed that I didn't quite read your newsletter before. I just read the material that you put out there in the ethos all of the times. I found that I just want you to know, I became a paid subscriber of your newsletter today. Why don't you tell people how they can find your newsletter?
My newsletter, thank you, Egberto. It's called Healthcare Uncovered, or Wendell Potter's Healthcare Uncovered, on the Substack platform. You can find it at wendellpotter.substack.com, or just Google me and Healthcare Uncovered and you'll find it. The content is free. I do appreciate the paid subscriptions because that helps us to do more reporting. We have, I think, some of the best analysis and essays on healthcare that anybody's producing, things that other reporters are not covering. And we have some other voices that contribute as well, too. So thank you very much. And I hope people will sign up. Again, it's free, but we certainly appreciate the paid subscriptions. It helps us a great deal.
Wendell Potter, one of the leading national advocates for major healthcare reform in the country and the author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans, as well as the other book that he just mentioned that will also be in this blog. Thank you so kindly for having been on Politics Done Right.
Thank you so much, Egberto. Thank you.
Welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Today, I'm honored to speak with Dr. Omekongo Dibinga. He's an upstander. His life mission is to inspire all across the globe to take a stand when they witness an injustice, no matter how small or large. A John Maxwell Team top 30 speaker. He's an international speaker, trilingual poet, TV talk show host, rapper, and professor of intercultural communication at American University, where he also serves as a faculty affiliate to the Anti-Racist Research and Policy Center. He is the author of Lies About Black People, How to Combat Racial Stereotypes and Why It Matters. Buenos dias, señor. Omekongo Dibinga. How you doing, my brother?
I'm great, bro. How are you?
I am great. Look, it's an honor speaking to you. I remember our early days back at CNN iReports when I think we got a little bit too hot for our britches, that it kind of slowly went down because it was too substantive compared to the milk toast thing that they were doing at the station. But how have you been?
I've been good, man. We were killing it, back in those days, man. It was a lot of fun. It's great to see everything you've done with your own platform. But, I've just been plugging along, raising kids and teaching kids, traveling the world and trying to create more communities where everybody could be celebrated and not tolerated, which clearly is needed now more than ever. But yeah, it's going well down in DC. Still running my wife and I still running our yoga studios, prioritizing wellness because, you got to put your mask on first and take care of yourself before you go do this work, and just taking it day by day.
Now, Dr. Dibinga, let me ask you this. Tell us a little bit about yourself first. Who are you?
Yes, well, as was said, my name is Omekongo, and that says who I am within itself. My parents are both from Congo, former Zaire, and that's where my name came from. I was named after the person who saved my grandfather's life as a child, and he was a great warrior in our village. I was born and raised in Boston, Massachusetts. My parents made their way to the United States in the 60s and ultimately moved around and settled at Boston, where they got their doctorates from Harvard and taught there for a while. So I was born in Cambridge, and they did a lot of activism, Pan-Africanist. That's how I was raised. So I grew up with my 8 siblings in Boston, graduated high school, spent the year at Morehouse, transferred to Georgetown, really got a love and a passion for international affairs. And that's kind of what my academic work has led to. So did my undergrad there, master's at Fletcher School, and did my doctorate in international education policy. And that was a great place for me because it allowed me to merge my interest in international affairs, also being a teacher. I did education policy, but also I did my doctorate on Jay-Z because because I'm also a rapper and a spoken word artist. So I was able to, and I did my doctorate on him. So I was able to combine all my loves there. And, since then, I pretty much stayed in DC, raising my 3 kids, like I said, and traveling the world trying to create more upstanders and not bystanders. My company's called Upstander International. And so we do consulting and, speaking and leadership training on how to create more upstanders and not bystanders.
I think the first time, we did a whole lot of reports. I don't know. I think I have quite a few hundred of them under my belt as well as you do. And we had some page counts out of this world. We were, I would consider us some of the most serious ones that used any platform that we could get to promote social justice, etc. And that is what I've seen you doing throughout your career in all that you do. But first and foremost, let me first tell you that I think teaching is the ultimate profession in this world, the most important profession, and I don't think it gets enough credit that it should in this country. Where you're from, where I am from, Panama originally, you from Congo. It's amazing because again, we revere teachers in those lands, unlike what it is here. What do you think? Do you think some of the malaise that we see in the country today, some of the miseducation, the ease with which people can be ill-informed, misinformed, and disinformed is a result of us not having the right respect for the teaching profession?
Well, what I would argue is that there's so much respect for the teaching profession and fear, which is why it's under attack.
Oh, okay.
You know what I mean?
I like that narrative. Yeah.
You know what I'm saying? Because
Yeah.
that's the first group that people are going for. And as somebody who does work in schools, public schools, private schools, charter schools, when I look at these attacks, I have a whole chapter in my book on critical race theory, and I notice that in these schools, they're not coming for the gym teachers. They're not coming for, even
coaches.
The coaches. They're not coming for building services. All these people whose, professions are important. They're going for the people who teach history. They're going for the people who can, transplant knowledge to our kids. And so and of course, who else are they targeting in the schools? The librarians. So they are targeting the people with the most knowledge. They're trying to take over the school board. They're bringing these racist folks to the school boards and all of that. And so because of the importance that teachers have in our society, they're not just being ignored, they're being attacked. And if you look at what's happening in our society right now, much of what is happening has to do with what we have not been allowed to teach in our schools. Look at, we haven't had civics in schools for like 30 years plus.
Mm-hmm.
And so you got people saying things like, oh, Vice President Harris needs to change the role and what happens in Gaza and things like that, not knowing that the vice president has no role to play and can't go against the president. They think that the president can just make laws. Yeah, they can do executive orders, but laws, there's this whole thing called Congress. There's this whole thing called the House of Representatives. And like kids just don't know these things, and therefore adults don't know these things. And so they look at all these individuals as the guys holding all the power, and it's this guy, it's that guy. And because of that lack of education, that's a huge problem. And then we have to obviously talk about things like book bans, where over 10,000 books were, have been put on the ban list, last year, more to come. So people fear education. As we both know, it's one of the first places that dictators go for. They go to take over the media and they go to challenge the intellectuals. And so we have to bring that back. We have to raise kids that are intellectually curious. We have to become intellectually curious as a society, and we have to embrace all forms of history as opposed to trying to deny it.
Now, by the way, has your book been banned yet?
Not yet. Well,
it's about to, right?
I'm sure it's coming.
It's coming. Now, given that, and I don't want to get directly into the election right now, I want to more concentrate on the disinformation that is out there.
Sure.
I love the work that you're doing. Okay. I follow your TikToks, and I like how you came out and gave the whole rundown on the election. I like but you haven't only done that on the election, you've done that on a whole lot of other things. TikTok is a platform that they're trying to take away. What do you think about it as a teaching tool?
Well, I'm a little bit nervous about all of these social media platforms because, one of the things we have to be mindful of is that, we use them and they're important, but they're also not controlled by, when you look at something like Twitter, not controlled by somebody who's from the United States. I believe he's a citizen now. But then you look at TikTok, it's the same thing. And, one of the things we have to be mindful of, and look, the US platforms are not any better, Facebook and so on and so forth, but we have to be mindful of who controls the information. And why am I seeing things like Joe Rogan on my Twitter feed and I don't follow him in any way, shape, or form? And I do believe that, TikTok has the ability to make sure that certain things they don't want to see, are suppressed on many ways. Sometimes I look at some of these videos and I'm like, how is like this going viral, but this isn't? Not even just from me. Like, I haven't had any viral TikTok videos, but I'm saying like even some people who have viral TikTok videos, you go and look at some of their other stuff, which might be more profound, and they're going like nowhere, right? So I'm like, how does that really work? But I do think at the end of the day, it is important for us, like people like you and me, to be on TikTok, because since a lot of our kids, or not a lot of our kids, a lot of people are getting their news from social media, it's important that we are getting into those feeds. People who have real information, real knowledge, can fact check things, can provide differing opinions, and I'm seeing people engage with you, and I'm seeing engagement with me as well from people who might be going to other places. So I believe that wherever there is an information platform, we have to have a presence there. And so my opinion on like TikTok is not like the same as like the US government, because, competition from China and all of the other type of stuff. I think that that's real for them. But as it relates to spreading proper information, we have to jump into these spaces and be engaged. And that's what I'm doing.
Well, and you're doing a great job at it. Let's talk a little bit about the election. What went wrong that allowed a misogynist, a thief, a thug, a person who lied about a university he never created, a rapist, and you can go on and on with probably 20 different things that he did wrong. How can people who have professed to be law and order folks, who profess to be the moral part, like to call themselves the moral party, how could we possibly, as a country, have elected a Donald Trump again?
Well, as I said across all of my platforms, TikTok and YouTube and all of these places, America'd. That's it in short. The fact of the matter is, Donald Trump ran a campaign that only a white man could run. He ran on the parents of racism and misogyny. It's a same-sex marriage. It's two males. He ran on those things. Look, they say that Kamala Harris ran on identity politics. She couldn't have run farther away from her identity because she wasn't allowed to. But Donald Trump was the one who said, look at me in my beautiful white skin. What's more identity politics than that? Donald Trump also ran on the politics of misogyny in terms of abortion. And, I ended it, everybody wanted it ended, and I'm proud to have done it. This idea that I'm going to, machismo, this idea I'm going to protect you no matter what, like those types of things, that's at the core of America. Look, as much racism as we've experienced in this country, black men still got the right to vote before white women did. So the misogyny is deep. And so, Obama had the racism, but he didn't have the misogyny. Hillary Clinton had the misogyny. She still won the popular vote, but she still didn't win overall because of the Electoral College, right? What did Shirley Chisholm say in the 1970s? That it was harder for her to run as a woman than it was for her to run as a black person. Yeah. And that was in the 70s. So, look, an Asian person couldn't get up there and say, look at my beautiful skin, right? Black, Vivek couldn't do that. So Trump ran on that. A woman couldn't get up there and be like, oh, I love men. I'm going to protect them no matter what. Only a man can do that, right? And so he put those together. And he created a campaign of addition versus subtraction, from our coalition. And then the fact of the matter is, we got to be real about this, Egberto, is that this country was not ready to elect a black woman. A lot of people who said that they were going to be down on her, these Republicans and the like, they lied. And then he also took advantage of the racism that exists between, people who are black and people who are of Latino descent as well. And that hate that exists between us. There were some who just said, I will just never vote for a woman. Someone just never vote for a black woman. And so he took advantage of, he didn't have a multi-months head start on Kamala Harris. He had a 248-year head start.
I love
Vice
that. Yeah.
President Harris. And if you go back to 1619, even longer than that. And so, and he played on all of that. And that's how we got to where we are today.
It is sad because I know even with Obama, I wrote an article at the Daily Kos a few years back after Hillary Clinton lost, and I pointed out that it is interesting that not even that I pointed out that just what you said, that misogyny and sexism, I don't like to do the comparison, but many a times it overpowers racism.
Yeah.
And I think once again, we see it, and then people want to make this election as if it is something that Kamala did. And I wrote an article on my Substack recently that said, this isn't about Kamala Harris at all. This is about America, and we have to wake up to this altogether. Now, do you think this is going to put a pause on any party trying to get a woman elected?
I fear that, and that is the problem. I feel like, she should run again. And people's like, oh, well, she didn't have time to do primaries. All right, go do the primaries. Like, see what happens. And I believe that the Democratic Party should keep putting up a woman until America is made to be ready for it. Look, you can't undo hundreds of years of misogyny with 2 electoral cycles with a woman at the top of the ticket. That's just not how it works in our society. And like other countries have had women presidents, and like some of them have, systems where, they have to be certain levels of representation of women, and there are disagreements with that, but it allows women to be put in people's face as potential political leaders so that when they get to the top, people are like, okay, we've been dealing with this for a while. But I do believe that in this next cycle for the Democrats, there is not going to be a woman at the top of the ticket. But let's add another part to this. Like, what does it mean for our society where somebody who has such a beautiful background as Vice President Harris and somebody who is white, like Hillary Clinton, both have to pick white males as their running mate? And let's add Barack Obama to that. Both Hillary and Harris went with 2 white men named Tim. You know what I'm saying? And it's just like,
yeah.
That idea that you have to do this to appeal to this group, and it couldn't be a gay man, couldn't be Pete Buttigieg,
Right.
couldn't be the, Jewish guy, couldn't be Josh Shapiro, because she would have been looked at as, too Jewish.
Let me tell you, Omekongo, you are one of the few that actually realized that. That the reason Shapiro couldn't have, even though Shapiro is the best guy. Oh no, Donald Trump would have made mincemeat out of that ticket.
Oh my gosh, are you kidding me? And again, that's identity politics at its best.
Yes.
So Kamala had to pick a white cisgendered male who represents Midwestern values to be on her ticket. Why couldn't she run with 2 women? Why couldn't she have like Wes Moore? Why couldn't she have a Ruben Gallego? Because that's what, because we also have to have a conversation about the Democratic consulting class and the people,
yes.
what I'm saying, who basically need to be there. And I'm saying that we need to take over the party and we need to shatter that. So if we get 2 women who run together as the candidates, if we get a white person and a black, like whatever it is, the status quo has got to go. But I feel like if they keep this same Democratic consulting class, we are going to have a white man at the top of the ticket in 2028. And that is going to be extremely problematic if they do it because of their traditional views. If people win the primaries and so on and so forth, that's of course fine. But in terms of who we say needs to be there, people are always saying people like, the governor of California or
Kentucky. They're up on Kentucky right now.
That's what I'm saying. Andy Bashir and all of these guys are just like, nah, we need to keep coming back hard. We got to take over this party.
I had a call. We were talking from a healthcare, the president of a healthcare for all organization yesterday. And that's what we were talking about. And I told him that progressive stayed quiet during this election. There's a whole lot that occurred during this election that we were supposed to speak up again about, but we never wanted to be accused of the one bringing down the ticket.
Yep.
And we held our tongues. And now I think it is time that our tongues be held no more.
Yeah.
Your thoughts on that?
Yeah. I feel like a lot of us, did come back, we were upset with like, why is she embracing, the Liz Cheneys and stuff of
Right.
the world? And, because her consultant said you got to build a broad coalition and people saying she's running away from the base. And I'll be honest, like, I didn't really feel like she was running from away from the base at honestly, because she was still in black churches, she was
Hmm.
still doing, she was doing black media, not enough, but she did a lot of black media outlets, a lot of black. I mean, so I'm not gonna say not enough. She did a lot. There were some places I wish she went to as well,
Hmm.
but I feel like at the end of the day, folks who were on the, one of the reasons she lost was because not because of the turnout for Trump, it was our turnout.
Didn't show.
Yeah.
But let me tell you something about that because I've researched some of that, and a lot of our no shows was the targeted marketing done by the Trump to different demographics, telling Palestinians she's anti-Palestinians, telling
Yes.
Jews she's anti-Jew, and some people who would never vote for Donald Trump, they didn't vote for Donald Trump, but they didn't vote at all.
And that is, look, that's one of my challenge with the level of sophistication of those of us
Yes.
who people who identify as progressives or so-called progressives. When I think about the uncommitted movement,
Hmm.
I'm like, that you all would not see what Trump had in mind. The guy literally said that Gaza it's great beachfront property.
Hmm.
And if we have the political sophistication needed to understand that vice presidents still make decisions, you at least put in the person that you have the chance of influencing the most. Now,
Right.
look, I think it was not cool for like a Palestinian person or someone who's like pro Gaza, to not be at the DNC, and we can talk about those things. But it's like Bernie Sanders says, it's like, okay, yeah, we can talk about Netanyahu being a war criminal and stuff, but we still have to get in somebody who we could possibly pressure. And when I look at people like Rashida Tlaib and all of those folks, pulling back, look, I get it. But again, this is about options. And now you got a guy who's going to be the ambassador to Israel, Mike Huckabee, who said there's no such thing as a Palestinian.
Hmm. Yeah.
The guy who's going to be the U.S. ambassador, the Israeli ambassador to the United States, currently lives in the West Bank. And so
Right.
the lack of, strategic, and I get it, we're hurt, we're feeling, and then, you're listening to a guy who just was lying to you about what he was going to do, and you decide to stay home for that, or you decide to go for a Jill Stein, who only appears when there's a woman candidate on running for office because she didn't run in 2020, and
Hmm.
you vote for a guy who sat at the table with Vladimir Putin. Like that lack of sophistication, Trump actually took advantage of that. Look, my family's Congolese. Like, I've been dealing with genocide in the Congo, and a lot of part of it's supported by a lot of the U.S. policy. So I've seen it firsthand what happens when this U.S. government is part of policies that is destroying your own country. So I'm sympathetic to that, and even with that, I'm still voting for Harris because we can pressure her to do. And I feel like her policy
Right.
would be
Yeah.
different.
Yeah. Look, that is important. I mean, after all, Bush bombed my country, to bomb Panama City, Colon, and David. Killed 10,000 Panamanians. They don't claim it, but killed 10,000 Panamanians. I still understand you have to separate country policy and person running. I spoke to Mark Thompson. I
Yeah.
interviewed him at Net Roots, and we were
Hmm.
talking about the same thing you talk about. It is time for us to start pushing the envelope. And I think coming now, starting now, I think progressives have to leave and you tell me if you agree or not. I think we have to leave the constraints of the Democratic Party for those who have held their tongues. And I think now that the Democratic Party is in flux, it is time for the progressives not to fall back on the who they wanted, Rahm Emanuel. They're talking about throwing Rahm Emanuel as the leader of the DNC. It's time for us to speak up, and not only speak up, but take over. Your thoughts?
Oh, absolutely. And, sometimes with this whole thing of, progressives, sometimes I call them so-called progressives because some of these white, progressives are the type who have that diversity fatigue and, don't really want to be as inclusive as they claim to be because they see so many of us rising, the Westmores of the world, the AOCs of the world, the Rashida Tlaibs of the world. And so I believe we do have to take over. We do have to, from the ground up, we have to challenge the consulting class. There's a lot of folks who are in these consulting classes. Roland Martin was talking about this. Some of these organizations just opened up like this year and got these consulting contracts and the like. And so we got to get in. We got to get on the ground game. We can't think about 2026 2028 because we got the midterms in 2026. And there's a lot of work we can do locally if we start to say this is what we want. And look, we got the vote. You know what I'm saying? In terms of we got numbers in terms of young people. There's going to be a whole slew of new voters who are going to be coming in over the next few years. And so, yeah, this is the time not want to withdraw. And I'm getting so upset, Egberto, because I'm seeing all of these, oh, I'm done. I'm going to go chill for the next 4 years. Oh, y'all can have it. I'm just going to be sitting my popcorn, all this other type of stuff. It's like, now is the time to get engaged. Roe v. Wade ended because right after Roe v. Wade was ushered in, these folks who are anti-abortion, they started then. They were having rallies every year, protests every year down in Capitol Hill. There would be like 10 of them. But it was like, we're going to stay the course. Our impatience is part of the problem. It's part of the reason why they get over. Because if Biden doesn't do something now, if Harris doesn't do something now, then it's like, all right, well, we're done. We're washing our hands. And that is part of our complacency, is part of the reason we got here. If we got the same amount of votes that Biden had for Harris, she's the president now.
Yeah, by a landslide.
By a landslide.
And look, we're talking for Roe v. And this is what I explained on my KPFT show, 90.1 FM. I told them, look, it took 50 years for them to overthrow Roe v. Wade. Some of the people who started the attempt to overthrow it are dead.
Yep.
The movement continued. That is what those of us that claim to be progressive need to do. We need to stay with the movement. We keep having these lapses. Obama came in and we went to sleep. It was like, no, you can't sleep on Obama. You have to push Obama. That's right. Biden came in. We didn't quite go to sleep on Biden, actually, because again, if you take a look at the policies Biden put out there, was a hell of a lot more progressive than Obama. The closest one is Roosevelt. But that said, we have to stay engaged. But Omekongo, I can't. We have to talk a little bit about that thing behind you, lies about Black people. Why did you write that book?
I wrote the book because I felt like coming out of 2020, the book came out in 2023. I felt like coming out of 2020, there were a lot of people who, especially like non-Black people, especially white people, were saying, okay, I was at the rallies, I shouted Black Lives Matter, but what do I need to do to go deeper? How do I challenge what I know more? And so I wrote this book to challenge the lies that have been told, because once you challenge the lies, then you can work towards policies that embrace the truth. But something was interesting when I was doing this, Egberto, is that I went online and said to people, tell me the lies that you were told about Black people. And I expected the majority of people to respond to not be Black, but the majority of people who responded were Black people. And so they were talking about lies that, we were told Black people can't swim, Black people don't go to college, and all of that. So the book is about anybody who needs to challenge the lies. The book is, each chapter deals with a particular issue relating to a lie, lies about Black people being more prone to be criminals, about education, about the history of housing, about Black people and images in the media. I go back to that. I have a chapter on artificial intelligence and how racist that is. I also infused the book with interviews with people who are on their anti-racist journey, people of diverse backgrounds. I also, of course, infuse it with some of my own poetry as well. If you ever want to hear some, just let a brother know. And then there are activities that people can do in the book as well on their anti-racist and what I would also call pro-equity journey. And so that's what the book is about. People can learn more about that at liesaboutblackpeople.com.
Liesaboutblackpeople.com. I'll have that in the accompanying blog that will come with the program. So, Senor Dr. Omekongo, what would you have liked me to ask you, talk about, or anything that I didn't? I mean, that's always my last question. If you ever heard my interviews before. Mm-hmm.
The most important thing that you could ask me is, what happens next?
What happens next?
What happens next is, number one, we take a deep breath and retreat into taking care of ourselves. We have to look at our habits that are preventing us from fully engaging. As somebody who, as a news consumer, like probably the majority of my waking hours, I decided, for example, I have to stop doing that. I have to make sure that my news consumption is minimized. I have to make sure that I'm getting my sleep. I have to make sure that I'm getting my rest, that I'm getting my exercise, that I'm checking on my diet. Because look, many of these guys, in my opinion, are going to try to take us out on many levels, whether it's, physically, whether it's through changing our platforms, destroying our platforms, whether it's through investigations, incarceration, whatever it is. But we can't take ourselves out. And so the more we take care of ourselves, the better we are going to be engaged in this fight. When Dr. King was assassinated, he was 39 years old, but he had the heart of a 60-year-old when they did the autopsy because of the stress of the movement. So we have to take care of ourselves. What next is we have to reengage in our communities. A lot of people who are mad at what happened can't tell you who their city councilor is, can't tell you who their state representatives are, can't tell you anything beyond possibly who their senator is. And so we have to reengage that way. The fight has not stopped. We had a night to be mad, but we have to stay engaged. If not, look, I'm not convinced. I am convinced that Trump is going to try to stay in office for a third term. I do believe that. And he's got the cronies to help usher that in. He even said that when he went and talked to folks at the House. Mm-hmm. And he's not joking. People have to realize when you study history, he is not joking. And so before you know it, it's going to be like, oh, shoot, what happened? And so at the end of the day, they say those are those people who make things happen, those people who watch things happen, and those people wake up and say, what just happened? Which one are you going to be?
Dr. Omekongo Dibinga, thank you so kindly for having been on Politics Done Right. Folks, you can find, wait a minute, isn't your website also omekongo.com as well?
Omekongo.com, upstanderinternational.com, they lead to the same places, and liesaboutblackpeople.com is a subset on that website as well. But people can also subscribe to youtube.com/Omekongo and all the social media platforms, just my first name, @Omekongo.
Well, all of that will be in the lead as well as in the blog that corresponds to this interview. Thank you so kindly for having been on Politics Done Right.
Thank you.
Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto, Willies. Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILL